Assalamu alaikum, everyone.
It's good.
Assalamu alaikum. Can be here. Yeah. Assalamu alaikum, everyone. I'm Amna AL Ajmi, Senior Radiation Therapist at Sultan Qaboos Comprehensive Cancer Care and Research Center. I would like to thank the Mr. Committee for giving the opportunity for the young RTTs to present their paper. I'm happy to be here. So today I'm going to present my papers, which talks about the effect of the hydration and the consistency of the bladder filling protocol during pelvic radiotherapy. Yep. So we all know that the bladder preparation protocol is just a set of the instruction which we have to follow to prepare for the bowels and the bladders for pelvic radiation therapy. So we know that it usually, what's this protocol? It usually involves drinking a certain amount of waters and hold the urine until after the procedure. And this usually happens after we ask the patient to clear the fluids and clear the bowels. And sometimes the patient may need also to follow a special diet to reduce the gas in the bowels. So for which cases we use this protocol, we use it in radiotherapy to treat different type of the cancer in the pelvis, the prostate cancer, the uterine cancer, the rectal cancer, cervical cancer, and the anal canal cancer. So we usually use it. What do we use it especially? We use it in the simulation scan before the scan, and we use it as well throughout all the treatment session. And then we move on. Why do we need the bladder protocol? So we need the bladder protocol, first of all, to ensure that the bladder is comfortably filled. So once the bladder is comfortably filled, this will reduce the side effect of the radiotherapy as well improve the treatment accuracy. So what happens when the bladder is filled? When the bladder is filled, it was just part of the small intestine, which lying just above it superiorly and potentially out of the radiation field. So this will lower the risk of the diarrhea as well the gastrointestinal toxicity. As well for treatment of the prostate cancer, it helps to keep the prostate in same position every day, and this will minimize the variation in the target volume and organ at risk. So when we comes up to the bladder protocol, we need two things to be available to ensure the reproducibility of the bladder filling throughout the treatment. First of the thing we need is the consistency, and then we need the hydration. So I think all of you radiation therapists, and when you come up to the level of the consistency of bladder filling during radiation therapy, it will be not easy because the patient will have different bladder filling rate and capacity, especially the patient who age in their 50s and above. And nowadays, even the young people will have issue with. So achieving a consistency of bladder filling during radiotherapy is really important again, because it ensures the optimal target coverage. If the bladder filling change during the treatment, this day patient will be 70% fill, and the other day will be 60, and the other day will be 80. So when you come up to the matching, when you took your CBCT, you find there will be a variation, because the excess of the bladder filling will push your prostate, or you come to the cervical cancer, it will push the uterus. So it will have many variations. Let's say you have this variation on daily basis. This variation will cause significantly compromise the accuracy and the effectiveness of radiotherapy. So therefore, we really need to maintain a consistency. When we come up to the hydration, it's really crucial to be adequately hydrated to make or to ensure that the urine is well accumulated in the bladder. So if you are not well hydrated or the patient is not well hydrated, there will be some amount of water which will be absorbed by the body, and this will interfere with our protocol. And we know when we come up to the Middle East issue, we have most of the people, even us, not only the patient, which they are not well hydrated. So there are several factors in the Middle East that contribute to the people not well hydrated. So first of them is the climate. We know that the Middle East is known for its arid climate with the high temperature. This will therefore increase the perspiration and make it subsequently a higher demand for the water intake to stay hydrated. And second thing, the lack of awareness. I think most of our people just have a lack of awareness about the importance of staying hydrated and the health implication of the dehydration. And then we have the lifestyle and the cultural practice. We all know that we are fasting during Ramadan, and you ask the patient not to fast, but they come up, they drink the protocol, and then they fast the whole day, so they are not even hydrated. And once they come up for the treatment on Sunday, they have been fasting on the weekend, so they are dehydrated, and that affects the volume as well. So we have a challenge that the patient during this study, when they come up after fasting, we had a big challenge in maintaining just a consistency of the bladder filling. So therefore, to address this issue, we came up with our protocol to just maintain a reproducible bladder filling through hydration. Am I going so fast? Okay, so we know that you all coming from different centers, and each center of you will have a different bladder protocol, depending upon your patient, depending upon your technique and type of treatment you are using. So our previous protocol, which we were following, was involving having the patient empty their bowels and bladder before the treatment, and then drink 750 ml of water, and wait for 45 minutes, and then go ahead with the treatment. So we have noticed and observed that this protocol has a certain effect in our practice. So first of the thing, it was a large fluctuation in the bladder volume, which could ideally lead to less than the ideal result, treatment result. And then it was really challenging for the patient to maintain the bladder filling from day to day, especially those people who age 50 and above find it really difficult to wait for 45 minutes, which was being long for them. And the second thing, the time constraint for the protocol, which was the 45 minutes, is also was a challenge, as the patient, I told you that the hydration play an important role. So the patient, which in the day which they are not hydrated, they take more than 45 minutes, sometimes up to 1 hour. And sometimes even after the 1 hour, the bladder is not even filled, they need just more water to be within the volume. So that as well was a challenge. The treatment time and schedule interruption. So when you have a inconsistency of a bladder filling, you get the patient into the treatment, and then you find out that the bladder is not filled, and then you release the patient. And as RV therapists, you know how much important the treatment schedule for you. You have to release the patient, and you have to immobilize the patient back. And the other patient in the waiting area, they are struggling because they are taking the patient in and out. So double exposure. So you take a CBCT, you find out that the bladder is not within the range. And I want to mention that even if it's a clinical decision, because sometimes you find it 70%, which the patient is not able to hold more, we took a clinical decision. And then once you release up the patient, we took another CBCT, so therefore you're going for the double exposure. So to address this issue, we came up with the new protocol, which was having the hydration process. When I mentioned the hydration here, present doing the IV. So we ask the patient to avoid the bladder and the bowels, and then drink the hydration process, which is the 250 ml of water in 15 minutes. And after 15 minutes, the patient will go back and avoid, and then will drink 500 ml of water and wait for 30 minutes before the treatment. So here I have just an example to explain you how this protocol is beneficial in the both situation. So just here I have 2 cups of water, which symbolizing the bladder of the same patient in 2 different days. So in the first day, the patient is well hydrated, and this much amount of water was the residual bladder volume after boiling. And then let's say you give the patient 750 ml of water when he was well hydrated, you will see that the urine will accumulate rapidly, and this will interfere with your protocol day-to-day changes. When you come to the second day, the patient is not well hydrated, and this much amount of water after boil, and then you give up the 750, I mean the oil protocol. So this amount of water is not sufficient for the patient because part of it will go for the hydration. So it won't be enough. And then again, you are interfering with the protocol because there will be a violation. So the hydration process which we introduce will be beneficial for the board. So let's say on the first day when the patient is well hydrated, and then you ask the patient to boil and drink the 250 as a hydration process, and then you ask to avoid back. So you are preparing your the bladder of the patient for the subsequent protocol, which is the 530 minutes. When you come on the second case where the patient is not well hydrated, and then you give the 250 for the patient and ask to avoid, you ensure that this hydration process with the amount of water given is adequately absorbed by the body. So 24 patients, the study involved 24 patients, which was the pelvic failed patients. The pelvic failed patients, so 12 were following the old protocol, which was 750 in 45 minutes. And the other 12 was with the hydration process, 250 in 15 minutes, and again 530 minutes. So around 601 CBCT were controlled by the therapist, reviewed by the physicist, and thanks to Muhammad who did all the review. And Dr. Nadim was verifying the contouring. The therapists in the unit were instructed to follow this protocol and document the daily timing of the patient to ensure the consistency. So this is a kind of the table we have been attached to the patient RT chart on daily basis. So once the patient come up daily, we just document which fraction number and which date, and then at what time he drank the hydration, which is the 250, and then at what time he boiled, which is the 15 minutes. You can see the time here with the 15 minutes. We ask the patient to boil, and then at which time he drank the 500, and then the CBCT at which time to be taken. So we really ensure that the patient should be positioned according to the protocol standard time. And the use of the SGRT system has simplified our process because we are going much faster in the positioning. Okay, so this is the data which we collected for the both protocols as we convert the daily CBCT volume of the patient, and we convert it with the CT volume, which we took it as a standard. So during the analysis, we analyzed the CT bladder volume and the median of the bladder volume during treatment, and then the difference between the CT volume and the median of the volume during treatment, which this one represents the consistency of the bladder filling as well the standard deviation. So as you can see here, we finalized that the average of the bladder volume during treatment was found to be 229.2, 229.22 with the new protocol, which involved the hydration process, and 252.59 with the oil protocol. So as you can see, it's here much less with the new protocol. As well as you can see, as I said here, the difference between the medium and the CT volume, which represent the consistency, you can see here with the new protocol, around 80% of the patient plotted in the same line, which says that they have a better reproducibility and constant bladder volume. So the conclusion that the hydration protocol, the hydration process protocol has really good impact in maintaining the consistency. It improves as well the quality of care of the patient, especially the patient who are 50 years and above. They find it is really easy to wait for 30 minutes rather than 45 minutes, and as well as the good chance after the 250 ml of water to avoid after 15 minutes. So they were happy with the protocol. The therapists were too much happy with the protocol because it enhanced the management of the treatment slot. And as well, it reduced the frequency of the CPCT exposure, which was much higher with the older protocol. And I would like to mention that our prospective study is to go empty bladder protocol for prostate patient and to find as well a normal standardized protocol for the female patient, that because we find during this study that nothing is working with the female patient due to many factors. Thank you all. Do you have any questions?